Tony is a mother of 3 sons. She says that her middle boy wanted to be a girl when he was just 2 years old. At 11, he began transitioning. Now Tony is grieving because she says she feels like her son has died.
At the age of 2, my son wanted to dress in princess outfits and all my niece's clothes. Everything was pink and purple. Everything was anything a little girl would want. It wasn't until the age of 4, he asked me when his penis was going to fall off and that he was a girl and he was going to be a mommy and he was going to be a big girl. Instinctively, he knew what he was. There was a time where I said, I'm done. You're a boy. You're not a girl. I'm not buying girl things for Christmas. I did try. And I hate myself for that. I went to the pediatrician and I said, why does he still think he's going to be a girl? And that's when she handed me paperwork about gender identity disorder. At the age of 11 and a half, I had to kick his door and he tried to jump out his window because he said if he had to live as a boy, he didn't want to live. I knew then that that was it. She just one day was my son and the next day she wasn't. I had to take every picture down and with that came a lot of problems. I go over to the cemetery around the corner. I just sit in front of a statue. I feel like I'm with my son that died. I would describe it as mourning, but it's hard, so I try so hard not to let her see.
Well, Tony says she doesn't question her decision. Obviously a very painful situation for you, but you think you did the right thing. Mm-hmm. How did you make the decision to support him transitioning from male to female versus saying, no, this is wrong, it's an aberration, it's a disorder, and he needs therapy?
Because I knew that that wasn't the right answer. I knew all along something was different about him. And I knew that he didn't give me a choice. He didn't really say, can I do this? He just said, this is what I have to do to live.
And furthermore, she has 2 other boys.
That's right.
Who have not had this reaction, not
That's
had
right.
this at all.
No, you know what? My first son, I was a single mom with for 5 years.
So what's your thinking?
Yeah, no human being is cookie cutter, and that's not surprising to any of you, that if you put kids in this situation, they're absolutely going to turn out this way. But what we find is time and time again, if kids do fit in a situation, they are likely or somewhat tending to turn out that way. It's not absolute one-for-one. We can't say that if we think that's the case, then we're just mistaken. But we see similar things here in that close relationship with mom and dad not being there, at least seeing in your profile. I mean, dad wasn't there.
Dad wasn't there after the transition,
Mm-hmm.
not before the transition. That was after.
How did Dad deal with the boys wanting to be female? When he would act feminine, what did he do with
We all
that?
went with it. We didn't know. We just dealt with it. We dealt with it. I tried to say, no, I'm not doing this anymore.
How did he deal with it, the father?
He dealt with it like I did. The child was adamant this is what he wanted, and we tried to do everything unisex. As much as you could do unisex, you try to do unisex.
This is different from what we would do at our clinic. We would involve the father more. We would encourage a bonding between the father and the son. We would discourage, not to shame the child, but to discourage the feminine interests, really build up his boy identity, make him feel good as a boy, and get mother out of her over-enmeshment with the boy.
My son, I was not close to at all. My second son. As a matter of fact, that's how my fiance became so close to him, because I wasn't close to him. I wasn't enmeshed with him. So I really think your theory sucks.
I mean, the question that I'm interested in is...
I just want to see your results. Like, where are your 16-year-olds now?
This is not just your position with transgender children. You also believe the same thing in terms of gay and lesbian as well. You deal with that in your practice, correct?
Yes.
And so your position is very similar.
Yeah, it's a little different because the approach is different, but in the case of the GID condition, it's working with the parents. And again, we see this over-involved relationship with the mother.
Okay, and you, Dr. Nicolosi, have written a book, A Parent's Guide to Preventing Homosexuality.
Right.
And do you, and many of the strategies embraced there are the same that you're talking about
we
here.
believe...
Although you don't consider these children to be gay.
But they're going to certainly, I mean, there's a 75% predictor that they will be homosexual or bisexual or transgendered.
All right, we got to take a break, and then I want to hear the doctors on this side respond to this.